this episode, we're going to talk about the workup. Obesity is one of the most complicated diseases we face today. By the time people walk into my office, they have already tried multiple diets, cleanses, detoxes, exercise programs, and they often feel frustrated or defeated. So how do we begin when I see them in the clinic? Today, I'll walk you through how I approach the initial workup in my practice and why it matters. As soon as you come in, we start with the basics, the vital signs, and risk factors. Every visit starts with the weight, the height, the body mass index measurement, the blood pressure, heart rate. And then I assess for conditions that are often accompanying obesity, like diabetes, borderline diabetes, high blood pressure, high cholesterol, sleep apnea, polycystic ovaries, metabolic syndrome, hypothyroidism, mood disorders, adrenal disorders, and even eating disorders. Obesity rarely stands alone. It's usually tied to all these other medical conditions that must be recognized if we were going to make real progress. The next step is looking beneath the numbers, your body composition. BMI alone doesn't tell me the whole story. That's why I use tools like DEXA scan or in-body scan to measure the muscle mass, the fat mass, the body fat percentage, and the basic metabolic rate. This helps me see not just what you weigh, but what that weight is made of. The next step is history taking. History taking in obesity is not just about getting the details about medical history. It's about hearing someone's story. I ask about the age of onset of obesity, the traumas, the stressors, or even life events that could be tied to weight gain, like pregnancy, menopause, infertility treatments, quitting smoking, depression, grief. Then we go over the prior weight loss attempts, like what worked, what did not work, and why. I screen for eating disorders, substance abuse history, how much alcohol you consume. And after I have gotten the history of that part, I go over the family history as well, because obesity, addiction, heart disease often runs in the family. Even cancer runs in the families. The next step is to go over medications, because some medications drive weight gain. We can often adjust them to a more weight neutral medication. Many people carry guilt or shame around their weight. My intent is always to create a safe environment, a safe space where we can be vulnerable together. The next step is to assess for lifestyle and behavior. I look closely at the daily eating patterns, the food choices, caloric intake, habits of snacking, cravings, what kind of beverages you consume, late night eating, whether you do home-cooked food or you do mostly carry-out, cooking methods, the kind of oils used, everything matters. Next, physical activity. Patients that I see can be anywhere on the spectrum from sedentary to being athletes. It helps me identify potential areas for intervention and the patterns. The next step is screening for mental health and sleep. Obesity is strongly linked with depression, anxiety, insomnia, and substance use. These must be addressed for any plan to be successful. If needed, I collaborate with psychiatrists or psychologists as part of the care team. Even sleep medicine. Sleep matters. Poor sleep quality or not having restorative sleep, sleep apnea can sabotage any weight loss efforts. The next step in the clinic is to get a comprehensive lab and diagnostics, a comprehensive panel to understand the metabolic health, the blood counts, iron studies, kidney and liver function, cholesterol panel, fasting glucose, A1C, fasting insulin to measure insulin resistance via HOMA-IR, thyroid function, vitamin D and B12 levels. Then, depending on the history, I may check for genetic causes of obesity and endocrine conditions as well, like Cushing's disease, polycystic ovaries, adrenal hyperplasia, or low testosterone levels. If we are considering stimulant medications for binge eating disorders or phentermine, then we get a baseline EKG as well to look at your heart. The point here is to look at the bigger picture, genetics, environment, and physiology. By the end of this initial workup, I usually have a very clear understanding of the genetic, environmental, psychological, and physiological factors that are driving someone's weight journey. This helps me also tailor a plan that's realistic, compassionate, individualized, and sustainable in the long term. My role is to be a partner, not as a judge or an expert. We often assume that The weight loss journey is going to be a linear process, but it's rarely a straight line from a point A to point B. It's usually a roller coaster with all its ups and downs. When setbacks happen, and they will, my job is to help patients avoid falling into that rabbit hole of guilt and shame. Because yo-yo of the weight isn't about weak willpower, it's just body's natural defense of fat mass. Life stressors like grief, loss, illness, steroids for an asthma, COPD, or arthritis flare-up, financial pressures can all shift the priorities to survival, and that's okay. My job is to remind people that struggling doesn't mean failing. The initial workup is not just about labs and scans, it's about understanding the whole person, their story, their biology, the environment. Lastly, most of my patients come to me after trying everything. They feel helpless. And I'll say to them that there's no quick fix because there isn't any. What I offer is education, accountability, compassion, and consistency. Obesity is a lifelong disease, but with the right tools, the right team, and the right mindset, it can be managed very well. When you finally see the progress physically, emotionally, and medically, those transformations are some of the most rewarding moments for me. In our next episode, we'll talk about how I build the treatment plans, why obesity care requires a multidisciplinary team, and how we can combine lifestyle, medications, psychology, and sometimes even surgery to create real lasting change. Thank you.